Okay, so the last complication we're going to talk about that's emergent is amniotic fluid embolus. And this is when a bolus of amniotic fluid enters the bloodstream of the mother and it triggers an anaphylactic type response. So amniotic fluid has stuff in it, has stuff floating in it, lanugo, vernix from the fetus, and then other things in it. And so it's stuff that's not supposed to be in the bloodstream. We have an inflammatory response for that. We have a response to foreign substances in the bloodstream. But when that response is triggered and it overreacts, we have anaphylaxis. So the response to this is similar to anaphylaxis. It often leads to disseminated intravascular coagulation as well. So the patient may have sudden onset of respiratory distress. They may have cardiac arrest. They may have shock. They're even if they don't have cardiac arrest, they may have shock where they vasodilate all over, and so their blood pressure is very low. So a sudden onset of cardiovascular or respiratory distress is a sign of this. Okay. Later, if they survive that initial occurrence, later, as in hours, not days, but shortly after, they may develop DIC, disseminated intravascular coagulation. Because remember, part of that inflammatory response is blood clots to stop to close a wound. But if that's triggered all over the whole body, we use up all of our clotting factors and then we don't have any left and we bleed. Okay. So risk factors: who's more likely to have an amniotic fluid embolus? Advanced age. Don't know why. Polyhydramnios makes sense because if there's too much fluid, they're more likely to have an abruption, which is one of the risk factors. Because if we have the placenta loose from the wall of the uterus, those vessels are exposed. If there's amniotic fluid in the uterus at the same time that those vessels are exposed, it can get exposed. It can get into the bloodstream. Okay. Placenta previa for the same reason. A post-term pregnancy, they go later. Induction or augmentation, probably because of the risk of abruption. Preeclampsia and eclampsia, probably because of the risk of abruption. An instrumental or C-section birth. Rapid labor, meconium staining. So a lot of those things, the reason they increase the risk for amniotic fluid embolus is because they are increasing the risk for abruption. What does this look like? The patient may have a sudden respiratory and cardiovascular collapse. They may suddenly get very short of breath or gasp and stop breathing. They may have extremely low blood pressure and rapid pulse of shock, or they may just have cardiac arrest. And then they are likely to go into DIC shortly. The mortality rate for this used to be a lot higher, but it is still pretty high. 22% is the statistic that's in your books. Management: this is a rapid response. We're calling for help. We're probably going to be coding that mother. If they're not coding when it happens, they're going to be coding within a few minutes. After 4 minutes of unsuccessful resuscitation, they need to go ahead and do a C-section there at the bedside. Okay. Any code with a pregnant patient, if they are, third trimester, we're looking at a significant size fetus. Not only do we do the C-section to try to save the fetus, but also we're going to be better able to resuscitate the mother if we don't have the fetus there putting pressure on the vena cava. You can't effectively resuscitate someone when we're smashing the vena cava and all the blood we put in them or all the blood we pump through them gets trapped in their legs. So after 4 minutes of unsuccessful resuscitation, they should do a C-section there at the bedside. If they survive that code, they are probably going to be on a vent. They're going to have invasive hemodynamic monitoring. They're going to need blood pressure management. They're going to need blood transfusion, probably because of the DIC and replacement of those clotting factors. They're also going to need fluid resuscitation for the shock. So this is another, when this happens, it's sudden, it's unexpected, and it can have really tragic outcomes. In the remaining sections, we're going to talk about some obstetric procedures.